Hello, Lisa. My name's Corinne. I'm the social worker here at the hospital, and I was asked to come talk to you. How are you today?
Not too good.
Why is that?
Well, I've just been so depressed. I just feel like I'm never going to get better. I don't know where I'm going or what I'm doing. I I just don't know what to do.
What makes you think that you're never going to get better?
I just feel like my body's giving out on me
Is that from the surgery?
from the surgery and just from in 2008 I was diagnosed with leukemia and I've had a lot of problems since, and the surgery's just one of many problems.
So, do you think that your health problems are all related to your cancer?
Yes, definitely.
And you think that your diagnosis of cancer is what's leading to your current stomach conditions?
Yes, it's all the medications I'm on that have bad side effects.
So, where does the depression come from?
Because I get separated from my family, I am away from home a lot, and I have a lot of pain.
With the pain, doesn't Dr. Doodad have you on um, different medications to help you with that?
Yes, he does, but it doesn't, it probably takes away 70% of it, but I'm still left with, especially moving, a lot of pain.
From speaking with Dr. Doodad, he's told me that physical therapy might be necessary in order to get you discharged. Are you aware of that?
I have been told that, but I'm not sure exactly where that's leading.
Can you be a little bit more specific on you don't know where that's leading?
I don't know if I'll go home for physical therapy or if I'll have to go to a facility for physical therapy where I would have to stay there.
Which do you think would benefit you better?
I am in such a weakened condition, I think going home would be a big mistake, but thinking of going to a nursing home just depresses me more because I've been in a nursing home and I was just miserable, but I really don't think I'm strong enough to go home.
So, with all of your medical conditions, you currently feel depressed and separated from your family, and you know that going home might not be the best option, but you feel that if you end up in a facility, you might feel more isolated and more depressed.
I would definitely be more isolated and more depressed. I would have to deal with it, and I would deal with it because I've went through it before, but I would definitely be very hard.
Okay, well, let's discuss the two options of going home or going to a nursing facility. Are there people at home that are able to help you?
I live with my mother who has very serious medical problems of her own. She's 70 years old. She has multiple sclerosis and scoliosis. And I also live with my youngest son, but he's gone most of the from afternoon shift working, so there would be nobody there from 12:30 till 8:30 at night to help me because my mother just doesn't have the physical strength to do it.
Okay. Are you currently able to walk by yourself?
No.
Or when you say no, you're not able to walk at all, or you can walk if you use like a walker or a cane?
I need assistance even with a walker to walk.
Alright, let's talk about your house for a minute. Are there bedrooms on the first floor that you could sleep in?
No, but there's a couch and a bathroom on the first floor that I have slept on before after a couple different surgeries I've had. The couch is, you take the cushions off and it turns into a bed, so that's where I could sleep. But there's no shower on the first floor. Half a bath.
So, sleeping on the sleeper sofa, how does that affect you in the area of pain?
It doesn't help my lower back.
So, if you were to sleep on the sleeper sofa, you would probably be in more pain than what you are right now.
Probably about 15% more on my lower back.
And without a shower on the first floor, that poses some hygiene concerns.
Wash my hair in the kitchen sink and just kind of wash up in the bathroom.
Okay. You might need to have physical therapy for more than just a couple weeks, though. This could be a prolonged, 4 to 6 to 12 weeks. And if we look at your current living arrangement as a possibility for discharge, it might be anywhere from 2 weeks to 3 months before you can take a real shower or a bath. Is that something you're willing to do?
If I went home.
If you went home?
Mm, that would be very difficult.
Are there any other relatives that are involved in your care that could help you while at home?
Yes.
And can you tell me about them?
Mostly my daughter-in-law.
And would she be available from the 12:30 to 8:30 when your youngest
No.
son? Okay. Are there any friends or family that would be available while your youngest son is at work?
No.
So, how do you feel? Let's discuss the nursing facility for a moment. What do you think are some benefits of the nursing facility?
I would get my therapy every day. I would have my meals 3 times a day. I would have my medication, so I wouldn't have to worry about forgetting about that, brought to me. I would have a nurse there to take care of my incision from my surgery, and I would have somebody there helping me for anything I needed as far as personal care or anything. And I know from being in a nursing home before, even if you're unable to walk, they can take you into a shower and help you shower.
So it sounds to me that we have kind of a situation on our hands of where would be better to meet your needs. I realize that if you were to go home, you'd have your family available to you for emotional support, but as of right now, you need help walking even with just your walker. There's not really an adequate place to sleep or to bathe, and that your youngest son isn't even available in mid-afternoon, so you'd be responsible with relying on your mom. The other hand, if you went to a nursing facility, you'd have all your personal care provided for you. You'd get all